Hello there and welcome to my YouTube channel. My name is Dr. Eleruwere Ayodele. In today's video, we'll be talking about vaginal discharge. Now, if you're a woman, at some point or the other in your life, I'm sure you must have had a discharge. And you ask yourself, is this normal? Is this abnormal? Why am I experiencing this? So in today's video, we'll be delving into all of that, including causes of vaginal discharge, the types of vaginal discharge, the symptoms that people experience, prevention and treatment modalities. Now, if you're a man, you may want to say, oh, this video is not for me, it's meant for women because it's women that have vaginal discharge. But now, vaginal discharge may mean a lot for men, so I want you to stick around to the end of the video where I'll be telling you exactly what vaginal discharge means for you as a man. Now, both men and women should stick around to the end of the video because I'll be giving some bonus tips, red flag symptoms that if you see them as a woman, you must make sure you see your doctor immediately. So please stick around to the end of the video. I'll see you guys in the next cut, okay? So great, let's jump straight in. First and foremost, I want us to talk about normal vaginal discharge. What is a normal vaginal discharge? Normal vaginal discharge is a discharge that most women experience normally. It doesn't have to do with any disease condition whatsoever. So what are the characteristics? Normal vaginal discharge is typically whitish. It doesn't itch. It doesn't have an odor. The vagina produces this liquid or this fluid to help moisten up the vagina itself and also to help with lubrication during sexual intercourse. Now that's normal vaginal discharge. Anything apart from this is considered abnormal. So what are the types of abnormal vaginal discharge? It may be quite difficult to group the types of abnormal vaginal discharge, but I will try my best and give it a very good shot. So stick with me here. Abnormal vaginal discharge can be grouped into three major categories. The ones that are caused by a sexual transmitted infection, that's one. The ones that are not sexually transmitted, that is two. And then the ones that are due to irritants. Let's recap. Sexually transmitted infection, one cause. Not sexually transmitted infection, and lastly, irritants. Now, how do these things, or how do these three categories cause vaginal discharge? So you see, STIs. Now, if you go to Bega or you go to Ogba or Oshodi, you will see bosses of traditional people trying to sell you medications, and they say staphylococcus is the cause of that abdominal pain you're having, that discharge you're having. All that is garbage. Okay. The number one sexually transmitted cause of vaginal discharge will be gonorrhea and chlamydia. I'm sure you must have heard a lot of gonorrhea and chlamydia. And then sometimes trichomonas, which is quite rare. So three organisms under that category: gonorrhea, chlamydia, and trichomonas. Those are the three organisms that commonly are the causes of sexually transmitted vaginal discharge. Now, sexually transmitted causes of vaginal discharge, Now, non-sexually transmitted causes, we have two diseases here: bacterial vaginosis and yeast infection. Okay, these bacterial vaginosis and yeast infection are not sexually transmitted. Okay, so if a guy out there, you think that a woman has vaginal discharge, oh, that means that she has had sex with someone and all that. No, some causes of vaginal discharge are not sexually transmitted. And then lastly, we have irritants. Irritants include things like antiseptic soaps, perfumes, wearing tight-fitted clothing that creates a lot of heat and moisture in the genitals, and hence give room for all these things. And then practices like douching, washing the inside of a vagina out, can easily lead to a discharge. Now, what are the symptoms? The symptoms of vaginal discharge depends on the causative organism or the underlying cause. Now, if it is bacterial vaginosis, for instance, the woman will experience this grayish discharge that is offensive. It typically smells like a dead fish. Okay, grayish discharge that is offensive. If it is a yeast infection, it is usually itchy. Okay, itchy, whitish discharge that creates a lot of discomfort. The woman always has this urge to itch the private part. That is usually a yeast infection. In my practice so far, it is the most common cause of vaginal discharge. Now, gonorrhea and chlamydia are the red devils. Okay, they are the red devils. They cause you to have pure pus coming out of the vagina. If you see pure pus that has an offensive odor coming out of your vagina, you have to see your doctor immediately, because this can lead to serious complications. Now, trichomonas is quite rare. Not a lot of people, in my practice, maybe I've seen one or two. It typically presents as this greenish discharge that is itchy as well and has an offensive odor. It's not as common, but let's just still put it out there. Prevention of vaginal discharge. How do you prevent vaginal discharge? So let's go back to the causes. We said the causes include STIs, so it just makes sense that you have to use a condom. Very good. Okay, now apart from that, practices like douching, which is washing the inside of your vagina out, do not do that. That will disturb the chemical balance of the vagina and give room for discharge. Okay, other things, wearing tight-fitted clothing, you have to stop that as well. And you also try to, as much as possible, not to use antiseptic based soaps. To wash your vagina, you just need clean water. That is all you need. So how do you treat? I'm not going to go into great detail about management of vaginal discharge, but if you have a discharge and you think it falls into any of the categories I've mentioned, ensure you see your doctor. Typically, for some form of discharge, they use creams on the vagina, some insertions in the vagina, and some may require injections, some may require tablets. Now, as I said at the beginning of this video, I said you should stick around to the end of the video, where I'll be giving some red flag symptoms that if you experience them, you must see your doctor immediately. Now, these are the symptoms that if you see them, you must see your doctor prompto, now, immediately. I don't even know any other word to use to describe them. If you have a discharge and you have lower abdominal pain, please ensure you see your doctor immediately. If you have a discharge and you have fever, please ensure you see your doctor immediately. If you have vaginal discharge and you are also bleeding with the discharge, please ensure you see your doctor immediately. Now, for all the guys out there, I promised you to tell you exactly what vaginal discharge means for you. Now, if you're a man and your spouse has vaginal discharge, please ensure that when she's going to see the doctor, you go with her, because as we said earlier on, some of the causes are sexually transmitted, and then you may not experience symptoms, but it may lead to infertility down the road, even though you don't experience symptoms. So you may need to be treated. So always keep that in mind. If you are with a woman and she has some form of discharge, if she's going to see the doctor, go with her. So if you need to be treated, you will get your treatment as well. Now that we've said all this, I'm sure most of you out there have had a discharge at one point or the other in your life. Let me know exactly what it felt like, what you did, what drugs were given, what you went through in the comment section below. Now, if you have any other questions as regards vaginal discharge and in fact any other thing at all, let me know in the comment section below. I'll respond to questions as promptly as I can, and I promise to respond to all questions in the comment section below. If you have any private thing you want to discuss with me, I'll be leaving a link to my mail down in the description below, so you can reach me at any point in time. I promise to respond to it as soon as I see it. So I'm actually looking for video ideas, so if you have anything you want me to talk about, any disease, any concept, it may not even be a disease, maybe something that affects us all in general, just let me know in the comment section, and then I'll look into it and see if I can produce something in that direction. Please don't forget to like, share, and subscribe. It's Friday here, I'm at work, tell me about it, and you try to have some fun. Okay, I'll see you guys in the next video. Don't forget to like, share, subscribe, and comment. Okay, I'll see you guys next time. Thank you. Bye bye. Have a nice one.